At Whole Woman's Health in Austin, Texas, clinic staff prep like any other day. But right now, this is a medical facility stuck in legal limbo caused by the most restrictive abortion law in the nation. Patients are still showing up and seeking care, but it's not care the clinic is always able to provide.
It's absolutely been a roller coaster ride. It's gone from being really busy right before September the 1st to having a sudden decrease in census and it being really slow and quiet in the clinic.
Marva Sadler is the Senior Director of Clinical Services here. She and Sonia Miller, the Director of People and Culture, are on the front lines of supporting patients who don't know what rights they might still have.
They're feeling confused, especially with the last few days of ups and downs. They don't know where they stand. They don't know who qualifies, who doesn't. And even without the ups and downs, just during SB 8, the rush to figure out if I'm pregnant sooner, the desperation of figuring that out.
The staff here face immense pressure to comply with the regulations while still providing compassionate care for patients.
This is really hard, right? It's really hard. The staff in our clinics are shouldering a really big burden and having to be the enforcers of a law that they don't agree with.
The Texas law, known as SB 8, went into effect on September 1st, banning abortion in the state once fetal cardiac activity could be detected, typically around 6 weeks of pregnancy. But 6 weeks still may not be enough time.
Most women don't have 6 weeks to make that decision. By the time you realize that you've missed your period and your period is late, we're already at about the 3 to 4 week mark at that time. And then by the time I get to the doctor to confirm that pregnancy, or I'm able to figure out how to confirm that pregnancy, we're already crept up to the 6 week mark. And again, I have to continue to remind everyone that there were previous regulatory issues in the state of Texas that already limited women's access and put a time restraint on how quickly they could get access in the state as well.
Now, any patient whose ultrasound shows a heartbeat must go out of the state to seek their care. That means Whole Woman's Health has only been able to provide care to about 20% of people they serve. The clinic hands out a list of other organizations that provide abortion in the states that border Texas. None of those are particularly close by. The closest, in Shreveport, Louisiana, is 5.5 hours away from the clinic here in Austin, by car.
For some women, just knowing that going out of the state is not an option for them kind of takes the choice of abortion off of the table for many women from the beginning.
Texas is the testing ground for attempts to outlaw abortion in conservative states. What happens here could shape policy across the country, but clinic staff warn that even closing their doors won't change the choices people make when facing an unwanted pregnancy.
Abortion is not going to go away. And we know that, right? History tells us that, right? Abortion has been around for thousands of years since we have been around and have had the, since we've been around, right? People who are pregnant will do what they need to do in order to live their best lives or even to survive.
At least today in Austin, despite the emotional turmoil for patients and staff and the barriers to seeking abortion care, Whole Woman's Health still has a message for the people of Texas.
Abortion is still legal in Texas, and for those women who are able to qualify, we want to make sure that they know that we're still here for them and that access is still available for them. And for those women who don't qualify, we still want them to know that we're available for them as well, to help them figure out what's next and help them plan what's next for themselves and what's best for them in the next steps. What's next for us at Whole Woman's Health? What I do know for certain is that we continue to fight. There's no way that we could be a beacon in the community for our patients and for our communities and continue to be here and be accessible to them, but not fight for what's right for them.